Let me, before I wrap up, I want to talk about a significant change impacting certain specialized mental health services for adults. If you provide behavioral health services to adults, the term 19I has, you know what 1915I is. 1915I is actually a section of the Social Security Act that explains a Medicaid service, and it governs many of the services that we provide to adults in Louisiana, age 21 and above. Effective December the 1st, we are no longer going to be providing any services through that authority. And there's a lot of special requirements that are unique to 1915I that we will be able to dispense with. And so you're going to see changes in processes and changes in forms. Here's a big change. As you know, currently Magellan gets independent assessments. They have a contract with Pathways and some other providers. The Bayou health plans will be using their contract providers to do those assessments. You can do assessments and also deliver services to the individual, which under 1915I is not, we did not do. And the locus summary sheets can be completed by network providers. Now, there are some caveats. The individual completing the assessment has to be a licensed mental health professional, and it has to be within their scope of practice. And someone completing a locus and doing that locus score needs to have completed locus training. A mental health professional who has completed locus training, not locus train the trainer training, or to be certified as a locus training, just have shown that you attended a certificate of attendance at locus training. So one thing, all 5 of our Bayou health plans have stated that they will make available locus training to their network providers. So if you have individuals, licensed mental health professionals, that you are interested in having complete assessments and locus trainings, let the health plans that you're contracted know with, so that they can know that you have folks needing that training. And then another form that was required under 1915I authority for providing Medicaid services was a freedom of choice form. And the freedom of choice form will be obsolete and no longer required for either children or adults. I talked about that grace period, the authorization grace period. I'm just going to, you'll see all of the detail in that informational bulletin 15-18. We've got the service type, whatever the end date is on the most recent prior authorization that Magellan issued, and that's the only thing that rules is what's on that form, nothing else. What is that duration of that grace period? What about in-network provider versus out-of-network provider? And who is responsible for paying the claim? And so let me just give you a quick and dirty summary. For outpatient services, with the exception of intensive substance use treatment, there's a 30-day grace period. What this means is if your prior authorization expires after 11/30, you had it expired after 11/30, it was good, expired 11/30 or after. Let me correct that. Your prior authorization expired 11/30. It was good through 11/30 or later. The grace period is 30 days, which takes us through the 30th day of December. And that means if the assessment, if the authorization, if the 1915I eligibility ends during that 30 days, is the claim will not be denied. If there are no more units, we're going to, the pro rata monthly amount of units would be added. The monthly amount of units would be added. So it's after, for any authorization that ends after the 30th day of December, which means December 31st, is you will need to follow the health plan's prior authorization policies in order to continue services. So this is for inpatient. We've got an intensive substance use treatment, 7 days. For PRTF, therapeutic group home, and for substance use residential, those are 14-day grace periods. Again, all the details in this very important informational bulletin. So the reason for the grace period is to allow sufficient time for health plans and providers to take action on expiring PAs during the transition and mitigate the risk of disruption in services. And here's again the trigger. Do you have a prior authorization that has the date November 30th on it? If so, it's good for that continued period. The inpatient and residential services, there could be split billing, and that's explained. You might have to send for some days after December 1 to Magellan, and for the rest of the period to your new health plan. And we've got a grid in that informational bulletin. One of the things, here's some tips for proactive ways that providers can assure timely authorization and reauthorization. Follow the Bayou Health Plan's authorization requirements once the grace period ends, or for any new services. If you haven't yet requested a service for a new person starting the 23rd of November, you can do that. Be aware that Bayou Health Plan's authorization requirements can differ, and they will differ from Magellan's, and they can vary by health plans. I saw one of the handouts from one of the plans, they have a list. These services don't require prior authorization. These services do, and it's different from what you know now. And so providers should review units previously authorized, what you're going to need, and not wait until the end of the time frame to request authorizations. Go ahead and send them sooner rather than later after December 1st. And then again, they'll start receiving them the 23rd. Now, what do you do about problems that might arise? We have an informational bulletin that is, I actually keep it posted by my phone. And it is for Bayou Health, I call it issue, escalation, and resolution. If you call the provider hotline and you don't get what you need, this is folks within the health plan to call, and it has that information and those levels. You need to familiarize yourself with policies about how members can file appeals, expedited appeals, state fair hearings, expedited state fair hearings. And providers can file appeals at the plan level. And we also have a web link on our webpage at BayouHealth.com. In the bottom right, it says, report an issue. Those come to us every day right here in this building, and we look at them and read them and troubleshoot them. We'll refer it to the health plan if appropriate and follow through and monitor that resolution. So we're going to be posting these slides on our website. The feedback loops that we have here, we had many of you attended one or more of the integration summits that DHH hosted. We've done the focus groups and surveys. If you haven't participated yet, every Monday, Tuesday, and Wednesday at noon, we have a call. We've got a toll-free line. You don't have to register in advance. We make announcements. We talk about what's new, and then we open the lines for feedback from providers. Many of the work aids and things that we have done are the results of these last 5 weeks of those Monday, Tuesday, Wednesday provider calls and the questions that you've given us. We're in the process of doing a major rewrite of the Medicaid Behavioral Health Services Definition Manual. We post questions and answers and keep those updated. We're having these informational sessions. If you have friends, colleagues who didn't come today, we're doing another one here Tuesday it's Tuesday afternoon right here in Baton Rouge. And then we are going to have in place on Tuesday, December 1st at 7 o'clock in the morning, a rapid response team. And we are going to be, I can't promise you that there won't be problems. What I will commit to you and promise you is that we're going to be in rapid response mode to address those problems. We've got all the information that I'll be posting on the slide deck. We've got those URLs for the website, informational bulletins, and our email address. You can always email us feedback at the address bayouhealth@la.gov, and in the subject line put something about integration question or behavioral health. And we've got the contact information for the plans. I strongly encourage you to visit each of the 5 Bayou Health plans, pick up some of the materials they're offering, and each of the health plans is also having webinars and trainings on their specific policies for their contract providers, and you can get information from them about that.